Welcome everyone. You can see, looks like attendees are starting to file in, so welcome to today's webinar. We'll just take a couple of minutes here as everyone trickles into the webinar platform before we begin, but nice to see everyone joining. So we'll start in just 5-10 seconds. Okay, looks like we're stabilizing a little bit. So let me go ahead and begin. So again, welcome to everyone to this webinar series, which is on hot topics in research ethics. I'm Joseph Ali. I'm a faculty member at Johns Hopkins and the Berman Institute of Bioethics, and I'm joined today by colleagues, both from the University of Malaya and also from our speaker today, who my colleague Sharon Kaur will introduce briefly in a moment. And so the webinar series that's hosting today's webinar is sponsored by the Fogarty International Center at the U.S. National Institutes of Health through the MORES program, which is the Master of Research Ethics Studies program. That's a collaborative research ethics training program of the University of Malaya in Kuala Lumpur that is jointly developed by Johns Hopkins and So the series has included so far 4 great speakers. They're listed on the screen here, you can see. We'll drop a link to recordings of prior webinars in the chat in a moment so that you can have access to those if you're interested in reviewing any of the previous speakers. Just a brief comment about the Master of Health Research Ethics MORES program. So it's now going to be matriculating its 3rd cohort of students. It's a month-long training, a year-long full-time training program in research ethics that has an application deadline every year of the 31st of May with a session intake of September. The program aims to support training of graduates who are equipped with the knowledge and skills necessary to engage in research ethics. And it's, as I mentioned, a program that's been developed collaboratively between Johns Hopkins, University of Malaya. With the support of the Fogarty International Center, we have the opportunity to offer up to 10 scholarships for each cohort for applicants from low middle income countries in Southeast Asia. So we welcome any interested individuals to apply or share the word about the program so others are able to join. Just a couple of sort of ground rules for the webinar. I'm sure everybody's been on many webinars over the past year and a half, if not longer. So this is fairly similar to what you've probably experienced with others, but just to note that your audio and video is muted. We ask everyone, if you have questions, to please type your questions or comments at any time during the presentation or afterwards in the chat box. And we'll moderate the questions following the presentation. We'll endeavor to answer as many as we can. Of course, it's not entirely always possible if there are many questions, but we'll do our best. And just a note here as well that today's session is being recorded. So with that, I'm going to hand over to my colleague, Dr. Sharon Kaur, and ask her if she could please introduce our speaker today. Thanks.
Sure, my pleasure. Thanks, Joe. So pleased today to be introducing both a colleague and a good friend, Tamra Lysaght, from the Center for Biomedical Ethics at the National University of Singapore. Tamra is an assistant professor at the center, as well as the director of research and the director of the Phase 3 Health Ethics Law and Professionalism curriculum. And I think Tamra actually really needs very little introduction because her reputation and her scholarship goes ahead of her. But just to highlight some of her areas of research include health-related data sharing, ethical, socio-political, and regulatory issues surrounding emergent biomedical technologies, as well as the exciting new world of One Health, zoonotic diseases, and now pandemic planning. So welcome, Tamra, and over to you.
All right, thank you very much for that very flattering introduction, Sharon. I am looking forward to the day when this pandemic resolves and we can enjoy another cocktail together. All right, I'm just sharing my slides. I'm assuming that I'm not on mute and everyone can hear me.
Great.
Great. All right, and I'm just going to move that out of the way. All right, so thank you for everybody who's joining us this morning in Asia and in the evening over in the States. So thanks for staying up so late. The theme of my talk today is on trustworthy data governance, and I'm interested in a broader question about, what does that actually mean in the context of sharing health-related data and in a place like Singapore. To address that question, I've been conducting research that is been aimed at developing governance models to encourage trustworthy health-related data sharing in Singapore with a focus on precision medicine. And we've just actually very recently completed the last of our data collection for this research. So you're going to be the first to kind of see the overall outcomes of this project that I'm going to present here today. Before I do, there's a number of acknowledgements I would like to make. Foremost is, of course, our sources of funding, our funders. Most of this research has been funded by a social science research thematic grant from the Ministry of Education in Singapore. We've also had some funding from the National Precision Medicine Steering Office of the Ministry of Health. You'll see here, I've had quite a great team here at NUS, and that includes Professor Yi-Xiong Tai, who's an endocrinologist at the hospital here. He's also at the Salisbury Swak School of Public Health, and he's co-chair of the Precision Medicine Steering Office. We've also had Associate Professor Angela Ballantyne out visiting to work on this project from Otago University. I have quite a number of collaborators from within Singapore and internationally who have come in on various aspects of the research to assist. I'd note Dr. Willem van der Boom, who's the statistician who's helped us on the survey, as well as our friends down at the University of Wollongong, Professor Stacey Carter and Annette Brannick-Meyer, who has been helping us with our citizens jury. We've also been consulting with an advisory group, particularly for the citizens jury, and that has included Professor Patrick Tan, who is also the other co-chair of the Precision Medicine Steering Committee. Oops, okay, there we go, good. Okay, so precision medicine, what the hell is that? It broadly aims to provide a tailored care to patients based on genomic data analytics that are combined with clinical, environmental, and behavioural information. Several large-scale initiatives have been launched or are about to launch in major health economies, such as in the US, Europe, and China. And of course, Singapore has recently launched its precision medicine strategy and has created a central agency to oversee the implementation of that strategy, and it's called PRECISE. Now, the basic idea here is that that genome sequencing data is stored in a central repository and that is linked to the participants' electronic medical records, which can then be de-identified and shared with healthcare professionals and researchers at publicly funded institutions, as well as potentially with private enterprise and commercial partners. Now, to do this, precision medicine initiatives typically seek broad consent from participants to store and share data. This model removes the need to obtain informed consent from participants each time the data is shared or is accessed for a specific purpose. However, it also relies on maintaining what's called a social license for the program to operate in absence of specific consent. The social license refers to a practice where that people are willing to accept as morally and socially permissible. But identifying those boundaries of the social license is difficult, and you often don't know where those boundaries are until you overstep them, and there is a subsequent public backlash. Now, this occurred with the widespread rejection of the proposed care doc data in the UK in 2014. Now, this was a proposal to generate revenue for the NHS by sharing stored patient data that's stored in the electronic record system with researchers from a variety of organisations that included pharma companies, pharmaceutical companies, which once that was made public, created so much controversy that the program eventually had to be disbanded. So the ultimate success of a precision medicine program is likely to be contingent upon identifying what the public expectations about data sharing and its management are, and establishing appropriate governance structures. Now, there are a number of theoretical models already out there for health data governance, and I'm not going to review them all, but just for today's purposes, at least, we are seeding our analysis within the big data ethics framework that was developed under the SHAPES program at NUS, which is under the direction of Dr. Vicky Zafis, one of my other collaborators. So very briefly, this framework is a 6-step deliberative process for identifying ethical problems that arise in various contexts where big data is used. It identifies the relevant values at stake and then weighing up the potential options to arrive at a decision on the most ethically justifiable course of action. Now, the working group that developed this framework identified these 16 values that are categorized as substantive or procedural values. Any one of these values could be applied to a particular context, but the framework itself does not privilege any of these values. So in reflection of that, these values are just listed alphabetically. So harm minimization is no more or less important than privacy, or autonomy, or transparency, but some may emerge as having greater salience than others once they are applied to a specific situation. Now, I will come back to this framework to show which values have emerged as having the greatest salience for sharing precision medicine data in Singapore. Now, our values have been identified from empirical research that using a mixed method multi-phase design that started with qualitative focus groups to explore the ethical concerns that Singaporeans have about sharing data for precision medicine. This fed into a national survey to quantitatively describe public attitudes towards certain data sharing arrangements that we identified as being problematic. And then we did a citizens jury where we invited a small group of Singaporeans to deliberate on some of the tensions that we were identifying. I'm not going to spend loads of time boring you with a detailed description of the methods, and I'm happy to take any questions about methodology later, but just to briefly explain, we ran 7 focus groups in between May and June 2019. These are multilingual, so we did 5 in English, 1 in Mandarin, and 1 in Malay. We had 62 participants all up, and we analysed their discussions using qualitative thematic analysis. We also did a national survey with 1,000, with N equals 1,000. This was run between December last year and was recently completed in February this year. This was composed of both a descriptive analysis to measure Singaporeans' willingness to share data under a broad consent kind of model, and also the level of trust they have in various institutions to use that data. We also included what's called an adaptive choice-based conjoint analysis, or ACBC. This is basically a decision-based experiment to estimate the relative value of various attributes. We chose this method because we didn't want to just ask people, what did you want from a precision medicine program in some ideal mythical world where we can have all of our privacy completely protected and have maintained complete control over how the data is used. And we still get free access to a cost-efficient health system. And hell, we'll even throw in a free car. What we actually wanted to know was, what are people willing to trade off in order to gain the benefits from a precision medicine program? What are you willing to accept rather than, what is it that you want? And thirdly, we did a citizens jury. Now, for those who are unfamiliar with this method, it is a deliberative engagement method. It's basically a democratic process that supports citizens to consider complex policy questions in depth and then make recommendations. So it basically applies principles of jury selection and decision-making that are found in common law judicial systems. That's where, like, jurors, hear evidence from experts and then deliberate over charges or policy questions to arrive at a decision. And the jury, the charge that we put to our jury was, under what circumstances, if any, is it permissible for a national precision medicine program to share data with private industry for research and development? Now, we decided to focus in on private industry rather than just, sharing with anybody for a number of reasons. One, first of all, the literature the international literature has already done some of these juries, kind of asking more generally about data sharing. We also know from the literature, lots of research is indicating that people might be very comfortable, sharing sort of health-related data, with universities and hospitals and healthcare institutions. They become much, much less comfortable when you start talking about sharing with private industry. And of course, this is the reason why, part of the reason why care.data fell over. Also, it was coming through in our own findings, and we've done sort of preliminary research before this project, which was indicating that the levels of trust really go down once you start talking about providing access to pharmaceutical companies and so forth. It is also a concern of the advisory group that I mentioned earlier that we've been consulting with. They are, that question is still quite up in the air as to what sort of the level of extent that they might share with the private sector. So we had 19 jurors. We did 3 days in December 2020, and then we called them back in to do a 4th day just a few weeks ago. So that should be April 2021, damn it. Okay. So yeah, this is very, very fresh data. I'm going to show you. All right, so these are findings, and I love this. This is a photo of us on the day 3 of the citizens jury, where we had them voting. And we literally had them with their sticky note. We had sticky notes which they put into a voting container, and then we pulled them all out and we counted yes or no. And there's Angela counting the votes along with Ryan, who was facilitating, co-facilitating with us. And this is Serene and Wei Jin, who is our research support. So our first major finding is that there is conditional support for sharing precision medicine data, both with the public and private sectors. So our jury did pass the charge and agreed that it would be permissible for a national precision medicine program to share data with private industry for research and development under certain circumstances. And they made 9 recommendations which spell out those circumstances, and I will come to those shortly. But all throughout our research and previous studies that I have been involved in, there is a general openness to sharing precision medicine data for research. As Singaporeans do recognise that even though, yes, there are security risks with hackers, and there have been a number of major data breaches in Singapore, so they do have experience with it. And there is a potential for re-identification, but these are ultimately being outweighed by the potential for benefits. And these, and not just, not benefits for themselves. In fact, a lot of them didn't see like what the immediate benefit to them as individuals were, but that there was sort of these greater public social benefits. So, and we have lots of great phrases like for the greater good and goodness of mankind, and so on like that. These qualitative findings are consistent with our survey results, where nearly 2/3 of the survey respondents indicated that they would be willing to share de-identified data for research, health research that's IRB approved or research, is approved by a research ethics committee without needing to consent for every study. So that was 2/3 of, So when we presented them with some of these, some of the options up here to explain their reasoning, which we actually brought out from, again, the focus groups, most of them were indicating that they saw potential benefits, that saw that the potential benefits were greater than the potential risks, and that they also trusted the research process. Only 20% of them, nearly 19% of them, indicated that it would just be too troublesome to consent every time. Whereas for the 1/3 that were not willing, a majority wanted to maintain control over the data, with some not trusting the research process or agreeing that the benefits would outweigh the risk. Now, this finding is quite similar to other surveys done elsewhere, where a majority of people seem quite comfortable sharing data, but a substantial minority still object to it. I mean, which just means you're not going to get everybody to agree to sign up to a program that uses broad consent. And that is okay, because you don't need an entire population signing up in order for precision medicine to work. But you could make it more appealing to those who are concerned through other arrangements that may engender greater trust in the system. And one of those looks like it's going to concern, the institutions and the people who are using the data. Now, we found that the highest levels of trust are in government and public institutions, much more so than the private sector, and significantly so. So these are all like error bars, and they indicate with 95% confidence that these differences are significant. Interestingly, and perhaps not surprisingly in the context of Singapore, is these very, very high levels of trust in government, and particularly the Ministry of Health. With one caveat, I mean, you need to keep in mind the context of the timing of when this survey was conducted. So it's quite recently, and we are still in the middle of a pandemic. And the government's management of COVID pandemic is widely recognised as being highly effective and competent, and this likely has boosted Singaporeans' trust in the government, when we were doing the survey. But to be fair, it is also what we saw in focus groups, and which were done before the pandemic broke out, and it's also quite consistent with some other unpublished surveys that we've seen. Very, very high levels of trust, and Ministry of Health in particular. More so than even universities, and particularly overseas universities, which might be a concern for allowing access to for academic medical research. But certainly, I mean, more so, look down here at the private sector, much less levels of trust, and IT companies, and Facebook in particular being right down the bottom, even though most of us are sharing huge amounts of personal data with Facebook and other tech platforms like Google and Apple, often without knowing, what they are doing with them, despite terms and conditions that no one ever reads. So these trust issues are also come through our adaptive choice-based conjoint analysis of our survey. Now, I won't go through the details of this. I just want to point out a couple of interesting points. So this is basically showing that the users and the users of the data were playing a much more influential role in their decision-making than the model of consent or the level of data sensitivity of the data. So if we look at these blue points along here, the different user options, they are spread quite widely, with government and hospitals here at this end being much more preferred over universities, and which were in turn preferred over pharmaceutical and biotech companies, and I guess private insurers are way down the bottom. And in just about every scenario the respondents were presented with, sharing with private industry was pretty much unacceptable for any purpose. Using the data for health research and quality improvement was considered to be much more acceptable than for private commercial use by pretty much anyone. And it's this wide range here that indicates that the users and uses were more important in the responses than consent and data sensitivity, which you can see is much more narrowly clustered here, indicating that whichever type of consent model wasn't really having a major role in their decision making, and same with the data, whether the data was identifiable or not. finally, these are the 4 values that have emerged as being priorities for sharing, for data sharing in Singapore. So it's accountability, transparency, public interest, and fairness. I'll go through each of these in turn, particularly in relation to the recommendations that were made by the jury. Accountability was hugely important. I just cannot underscore the salience that this that accountability had, particularly for sharing with, again, the private sector, which is what the jury was was concerned with. So so these are the recommendations, again, are relating to the types of conditions that they would like to see placed on the data sharing arrangements. So they wanted that there must be an accreditation process to ensure that private companies receiving the data are competent, reputable, and trustworthy, and that there should be enforceable contractual mechanisms in place to ensure that overseas companies can be held accountable. Now, they wanted this because what they were worried about is that basically overseas companies coming in, taking the data, leaking it, or misusing it, either inadvertently or not, and not being accountable for that under Singapore law. So they wanted to make sure that there's those legal mechanisms of accountability were in place. Secondly, if they wanted, if companies did breach the terms of their contracts, that they wanted to ensure that the penalties were proportionate to the severity of the breach. And those penalties should include loss of data, loss of access to the data for a number of years, fines, as well as potentially criminal charges, which, if you know anything about Singapore's legal system, it makes complete sense. So what they're worried about here is basically large multinational companies being handed a $100,000 fine for a very serious breach, which for some very large companies, this is nothing. So they want to make sure that the penalties have a pinch. They want them to be punitive. And in this last one, they also wanted, not just organisations, but also teams and individuals being held accountable, and both within the companies receiving the data and also the public agencies responsible for releasing the data. So they didn't want just the organisation absorbing a responsibility for a data breach. They actually wanted, people or teams of people, a group of people, stepping up to account for the breaches, where they do occur. Another one, this is also a very important one, was about oversight. So that there should be an interagency committee set up to approve applications for sharing the precision medicine data with private industry, and that this committee should include broad representation from not only a variety of agencies or ministries in Singapore, but also the community. And this was really also reflected in our focus group findings, which we published last year in Biomedical Ethics, and I titled it with one of the quotes that was made in the focus. One of the focus groups was, who is watching the watchdog, which really spoke to the need for independent oversight and this idea that it should be broadly inclusive with community representation and not just the people whose interests are being watched. Fairness. So they also said that this oversight committee should not merely consider security and privacy issues, but also wider societal issues, particularly with respect to fairness and social justice, like considering equity between the cost of medicines. So, they're worried about the increasing costs of healthcare in Singapore, as well as, unfair discrimination with insurance. So, and these concerns have been raised because, unlike in the US where you have GINA, Singapore does not yet have any sort of non-discrimination laws that protect genetic information. We do hear that they're on their way, but they're not yet in place. And this also came through with this other recommendation that if there's going to be any sharing with insurance industries, and again, quite a few of our jurors and the surveys, the overriding response to that is that they should not be shared with private insurers. But if it is, it should not be done so until there is anti-discrimination law in place to prevent genetic discrimination for life and health insurance. So And this other one is that it's also reflecting this, this recommendation is reflecting this value of that there needs to be some public interest in whenever data is shared, particularly with private industry. So that means that there should be public benefit for Singapore in sharing the data. This doesn't mean that, you know, companies can't make any profits. Singaporeans are very pragmatic. After all, we call, you know, Singapore as Singapore Inc. Incorporated. So they understand what it means to be a business, but they're also saying that there should be a public interest imperative for allowing the private sector to access the data. The public interest value is also evident in our survey. So coming back to the conjoint analysis, not only with this high preferences for health research and quality improvement, you know, that is more likely to generate benefits than private commercial uses, but also interestingly, you know, with this here, this slightly, you know, higher preference for sharing de-identified data that is linked. So de-identified genome data that is linked to the electronic medical records over, you know, not having those two linked. And this, you know, suggests that they recognise that there'd be higher utility for researchers in, you know, and having linked data rather than having unlinked data. And, you know, and this higher utility could, you know, predispose that there's preference for higher public benefit. Finally, transparency, and the jury made this set of recommendations on the information that should be publicly available. That includes the process for decision making, you know, which companies get access to the data and for what purpose, a summary of the outputs so that people can judge for themselves as to whether, you know, the benefits of the program are indeed outweighing the possible risks. And of course, when there is a breach and what penalties are in the end issued. Now, the jury recommendations were also contingent upon these three assumptions that these assumptions actually started out as recommendations, but became clear to us that they were actually more relevant. They were relevant to the precision medicine program more generally. And we also were able to find out that these are going to be features of the precision medicine program in Singapore. And so, basically all of the recommendations are premised on a contingent upon these assumptions that one, that data shared with private companies are de-identified, and in fact, you know, anyone accessing the data from the precision medicine program in Singapore, it's going to be de-identified data. People need to opt into precision medicine. By that, it means that you can't just ring fence everybody in the health system and, you know, wait for them to make, presume consent, and then they have to opt out. There needs to be a sort of an active opt-in to the program itself, and then they must have the right to withdraw at any time. And of course, we're still a bit of questioning about what withdrawal means from a data bank, but we can leave that for a citizens jury later on. And when people do consent to the precision medicine program, of course, this information should be comprehensible. It shouldn't just be this long list of terms and conditions that no one reads and they just, you know, press, you know, agree, and then they sign into it without really kind of understanding what the implications of the data sharing arrangements are going to be. So returning to my original question about what trustworthy data governance in Singapore might look like, well, we found these four values that are going to have likely to have the greatest salience in any kind of ethical framework for sharing precision medicine data: justice, public benefit, or accountability, and transparency. So my kind of question is, you know, I do wonder, you know, whether these would look any different if we kind of did this research in a place like the United States or the UK or indeed Australia, where I'm from originally. Possibly we might find that, you know, values of autonomy and privacy having greater salience over public benefit and justice. I don't know. or maybe not, maybe we just need to ask the questions a bit differently. Again, a lot of the literature has gone and asked people, you know, what is it that you want? And yeah, people want to maintain control over the data, and they want their privacy protected. They want, you know, minimal to no risk of, you know, data being re-identified. And of course, and everyone still wants their free healthcare. But given we can't have everything, you know, what are you willing to accept in order to gain trust in a system of governance? And with that, I will say thank you, and I'll hand the floor back over to my hosts. I stop sharing?
Yeah. Thanks, Tamra. That was really interesting. If I may, I'll take the first shot at asking a question, which is I think closely related to how you ended, and something I'm genuinely very interested in as in how we, you know, identify maybe the primary values or principles that might be engaged in different settings. And I know that just very recently, in relation to the COVID-19 and the steps that might be taken to sort of open up international travel, we did a research across Hong Kong, Malaysia, and Singapore about the views of people. And it was extremely different, right? The levels of trust in Singapore for governmental measures and standardization were very high. And as you can imagine, in Hong Kong, they were very low. And in Malaysia, we were pretty much in between. They sort of did it, but didn't trust the government at the same time. So I'm just wondering if you, you know, you have this great framework, and if you have different people in different contexts trying to grapple with how to use these principles and how to understand what is best for them, I mean, how would they even begin to go about doing that?
Oh, that's a big question. So I think I just want to make one point. I think that the very high levels in government, trust in government we see in Singapore is potentially quite particular to Singapore. You know, the government, you know, there is a, you know, the history, there's a socio-political history attached to the system of government here in Singapore. So we have had the same political party, the PAP in power since Singapore was national, you know, became its own nation, you know, 50 odd years ago. And, you know, they are generally seen as being very competent, you know, and there's lots of trade-offs that are made, you know, in order to sort of, you know, have these lovely benefits. Like there is a quite comprehensive public housing here in Singapore. There's very low homelessness. Most people are living a very nice, comfortable life. There is a robust healthcare system. And of course, we've seen the high level of competency kick into action throughout this pandemic. So I'm not at all surprised to see those very, very high levels of government in Singapore. And, you know, but I mean, you know, and I kind of pose that question about, you know, what would it look like, you know, in a place like Australia, for example, which does like to see itself as being kind of more aligned to the libertarian values of the United States and, you know, and Britain. But that's not what's come through in this pandemic. They've actually very much been listening to experts and sort of trusting governments. Of course, not everyone's been happy with the pandemic control measures in Australia, but, you know, everyone's actually quite happy that they're all safe, and there's no, it hasn't been, you know, a major outbreak of COVID-19, you know, since the initial wave back in about this time last year. So yeah, so that set aside, I think if you're talking about the framework, the big ethics, the big data ethics framework, they don't, so the framework itself does not prioritize any of those values. And I guess it's a matter of, you know, and this is where we think actually, you know, empirical research does play a important role in ethical sort of decision making. Is, you know, it's like, so, you know, which values, you know, should do take salience in a particular context. And you know, and this is where these sort of public engagement sort of methodologies can come in handy. Now, just because, you know, this is what people, you know, want or prefer, that doesn't imply ought. And so, you know, these empirical methods are never going to, you know, obviate, good ethical analysis. And that's always I think it's step 4 in the framework is how do you then balance and prioritize these values, and for that you need some robust argumentation techniques, skills.
Thanks, Tamra. Thanks again for your fantastic presentation. We do have a few questions coming in here in the Q&A. Maybe I'll try to run through a few of them with you, if that's all right. So I see the first is maybe just a question about whether or not, I take it to be a question about whether you've published the quantitative work or maybe the survey work yet. I think we shared the link to the qualitative piece in the chat there, but I don't know, it looks like individuals are interested to see the publication if it's coming out, or I'm not sure.
It is currently in preparation, so it's in my inbox. So I'm about to go through the next draft today.
Add some pressure to you.
So we don't have, so it hasn't gone under peer review, so don't go and hang any serious public policies on it yet. But
great.
We're quite confident.
Great. Yeah. So there are a couple other questions here. I'll take the next one, which is really, I think, about this concept of de-identified data. You had mentioned, I think, even in some of the the jury recommendations, that there seemed to be some, maybe difference in understanding about what de-identified implies, or you had mentioned, the desire to withdraw data, that the panel also seemed to recommend that it be de-identified data. So anyway, interesting issues there. But it looks like this question is about, I guess, first of all, the fact that there are sort of maybe different kinds of understandings of de-identified, and then that, as we know, there's always some risk of re-identification in genomic and genetic data particularly, but that it seems like there's some technology solutions that are emerging. And I guess maybe a way of phrasing this would be whether or not, those issues have emerged in your work, and whether or not some of these solutions have been considered either by the study team or by participants. So your thoughts on de-identified.
Well, I'm not a data scientist.
Yeah.
I'm a bioethicist, so I can't comment on the technologies. For the, this was kind of, this does is kind of getting to the core of how, complex the issues are, and why a sort of citizens jury is so valuable, because you get that time to sort of, you bring in experts who can comment about de-identification techniques, and and what the sort of the trade-offs are, like the harder it becomes to the more robust the de-identification technique, the harder it gets to re-identify someone. So if someone does want to withdraw, you have to maintain those kind of mechanisms, or the pass keys to be able to find their record and delete it. But I think it's fairly confident, even by the end of the 4 days of the jury, I think they had their head around the kind of the basic idea of the identification, and that that it is coming with a trade-off. If you want to be able to withdraw, you can't completely anonymize the data. But yeah, and we were talking about consent. So there had been discussions about about specific consent. So if you have specific consent, so every time a company wants to come in and access the data, and they want to access the record of like 300,000 people, you have to go and re-identify 300,000 people in order to get them to consent to this particular use. And for that, to be cost effective, you're going to need, a very low threshold of de-identification, and that then, of course, increases the risk. It not only increases, the cost of the system, but it also is increasing the risk that someone else might be able to sort of come in and re-identify the data. So yeah, we're able to, see where those kind of trade-offs are. Certainly, you can't do that in a survey. So as with any survey, you have to, take into account caveats that you don't really know what people were interpreting, even though we provide, definitions of what de-identification is and research and everything, you don't ultimately know kind of how they were processing that. And even with a focus group, it's still only a 90-minute session, right? You can't really go in deep. And we did sort of see with the focus group discussions, a little bit of confusion around identification about data being, still being identifiable to them if it's being de-identified. But I think with the citizens jury in that process, you can get in and help them to more clearly understand what's going on.
Thank you. Yeah. So just if I could add maybe another question in here about maybe clarification. So when you were conducting the work and paneling the jury and things like that, it sounds like you had some process where you came to a common understanding on the terms, as you were saying. Was there some effort to sort of standardize a definition of broad consent? And if so, sort of what did you how was it presented in terms of definition and characteristics to the group?
Yeah, consent is I think you can have a citizens jury just on consent. It is really quite, and it doesn't help that also, academics, that we are actually using different terms to mean different types of models of consent. We did have Professor Ainsley Newson come in and do a presentation and explain different consent models. We did have a nice flow chart diagram which they had access to, but yeah, by day 3 it was clear to us that they weren't completely understanding the difference between different models, and perhaps that might also explain why in the survey it wasn't playing a huge influential role, because so I just think that the whole concept of consent is, if we can't agree and get it right, how are we going to expect the public, people, who's going to maybe engage with it for maybe 10 minutes in their consent process.
Yeah. Sharon, did you want to jump in?
Yeah, I did want to jump in and just ask a question just about, and I think that's such a great issue, right? How to actually provide information to your citizen jury to an extent and in a form in which they will actually be able to understand it and have it presented to them in a fair manner. So I'm just wondering how you ensured the sort of independence of your witnesses, or rather the independence of the information. Particularly, I see that there's a lot of mistrust about the involvement of private industry. So then again, I'm just wondering, did you just ask them questions based on their own understanding of what they perceive private industry involvement to be? Or did you actually provide them with details about, private industry has done this and that, both good and bad? And I'm just curious how that feeds into ultimately their perceptions.
Thank you. That's a really great question, Karen. We had I think we had a really great design of citizens jury, which Angela Ballantyne, primarily led, and we were helped out tremendously by the group down at the University of Wollongong, Annette Brownett-Mayer and Stacey Carter, who had recently run similar citizens juries down in Australia. And we hope to write a paper so we can, drawing out and reflecting on our, respective experiences and results. So the first thing, and we're educators, so we know all about scaffolding. So we did building quite a bit of scaffolding for them. So we did just kind of throw them in. But in terms of, expert witnesses, everyone has kind of got, I don't think there's any such thing as people coming in, completely disinterested, but we did try to bring in people who were bringing a sort of a balanced perspective. But in terms of, the, sort of advocacy for private industry, we invited stakeholders to come in and talk to the jurors in a carousel sort of setting, so they could sit down in a small group and talk to You know, we had one of the CEOs of a biotech company here in Singapore who was interested in potentially accessing it, and he was very charismatic. I think they all liked him, and he was actually very forthright in terms of, you know, well, I don't know how we'll benefit from it. You know, of course, we're a private company. I'm here to make money for my shareholders. And we also did have, you know, a representative from the private insurance sector sort of come in again and, you know, make their case as to, you know, what the benefits of sharing with private industry would be. So I'm fairly confident that we weren't presenting a picture of the private industry being all evil and bad. They were able to, you know, form their own judgments, I think, at the end of it.
If I could maybe just pick up on that, Sharon and Tamra, there's a comment, a couple of questions here in the chat and the Q&A that I think build on that last point, which it seems the question really relates to specifically to direct-to-consumer firms and for genetic testing and access to data by those firms. But it sounds like, I think the impression I get from the question is that really it's about sort of, you know, multiple layers into the data sharing, right? The potential for data to be accessed, perhaps in ways that may or may not conform with the initial terms of sharing, you know, and those kinds of things. So, but specifically they ask about, you know, data being accessed for crime investigation, insurance companies, hackers, those sorts of things. And then the follow-up question looks like is also about accessing data to follow up on old cases and things like that, and criminal cases, et cetera, where genetic information can be quite valuable. So yeah, I think that take that to be sort of secondary, tertiary, sort of onwards forms of access to data by various actors for various purposes. So anyway, if you have thoughts on that.
Okay, so there's a bit in there. So I'll just try and pick out bits I understood. So with the direct-to-consumer genetic testing, so I don't think there is any companies in Singapore. Now we did actually, we did try to find tech companies that sort of would be interested in accessing this type of data, you know, inviting them down to be stakeholders, and we could not get any of them to agree. And there are a couple of really big players in Singapore, you know, trying to, you know, set up platforms in Singapore, and Apple being one of them, which doesn't do a lot in terms of, you know, if transparency is, you know, is going to be a really important value, you know, hiding behind confidential disclosure agreements, I don't think is going to be terribly helpful in terms of engendering trust. But anyway, that was just an observation that I'll make and probably won't publish. But it's interesting that you raised the issue about authorities gaining access for criminal proceedings, and you know, in Singapore we have a contact tracing app called Safe Together. It uses Bluetooth, and it captures handshakes with other, you know, devices that you've come into sort of close contact with. It was widely rejected in Australia when they tried to introduce basically the same sort of platform. In Singapore, I think about 90% of people have downloaded or have a token which performs the same tasks. And because last year when they brought it out, look, no, we're only going to be using it for contact tracing. It's just for the public health intervention so that we can manage, you know, the spread of COVID-19. And then, of course, it was subsequently revealed that the authorities were able to and had accessed it for criminal proceedings, and so they had to backtrack quite a lot. And so, because Singapore does actually have quite wide-reaching laws that do allow sort of access for criminal investigations, so they actually had to bring in another law that would limit the types of criminal investigations that they could access this data. And I'm trying to remember the timing. I thought actually might have been around with the survey, certainly in between sort of the first few days of the jury and the last one. And we thought that this would have a massive impact, and it didn't really. You know, it was kind of, you know, there was a bit of a kerfuffle made about it, but yeah, so I think that would be, it wasn't sort of something that came up enough that we, you know, that it sort of made it into recommendations, but, you know, that could potentially be something that us as kind of academic observers might want to remind them that that they need to be transparent about exactly who is going to be able to get access to it and under what circumstances, and then people can decide whether or not that's acceptable or not.
Interesting. Yeah, that case of, you know, the digital contact tracing example is quite interesting, and I think we're in some respects seeing similar activities occurring even with vaccines in a different way. But I'm thinking of, you know, Israel in many ways similar to Singapore, you know, adopted some contact tracing technologies and was early adopters of vaccination campaigns and things like that. But the government there brokered an agreement with Pfizer, you may have seen, I don't know, that to share citizens' data sort of on their behalf with the company in exchange for sort of access to vaccines and the like. So it's an interesting example where a national government sort of brokers citizen data. I don't know if that's come up in the Singaporean context in relation to the precision medicine initiative of thinking about sort of who is the appropriate sort of broker of this between private sector and research institutions and others, what role the government has and what power and authority they have in this. But it seems like you were suggesting that the government sort of, there's a lot of trust in government, so perhaps they are a trusted broker. I don't know. It's interesting.
Yeah, I assume. So I mentioned that they've already established an agency that sits under the Ministry of Health. So I'm guessing that is going to be the agency that would broker the types of private, you know, data sharing arrangements with the private sector. Yeah, I mean, whether they, you know, set up some sort of independent oversight, if they listen to our recommendations, they will, you know, establish some sort of independent oversight or, you know, ethics and governance committee, you know, with representation from different sectors, and of course, and importantly, I think community representation, and that we would hope would help to engender, you know, greater trust in those data sharing arrangements. But I think, you know, I think the important thing, I think, with the Israeli and Pfizer arrangement is that, yes, you know, people have been willing to sort of trade off, you know, protections of, you know, privacy and you know, consent around, you know, the sharing of information back to Pfizer, but they've gotten a benefit. They realised the benefit from that arrangement, which has been they've had priority access to vaccines, and now, you know, they're down to less than 100 cases a day. You know, I don't know how much of that is actually directly attributable to the vaccination campaign, which has been largely quite successful, or the other sort of public health measures that had to kick in around after Christmas, after everyone went on holidays. So, but yeah, I mean, this is the trade-offs. I mean, we're making these all the time, and you know, and that's a really great example of how people did trade off, you know, other values. It's not saying that, you know, my autonomy is not, you know, is not important to me, or my privacy is not important to me. It's just that other things are more important in that particular situation.
Interesting, thanks. Yeah, it does play out interestingly in a secure, sort of so-called security state where the government has a particular role, anticipated role in general. But I think we're unfortunately reaching the top of our hour. So I think we should probably just start to wrap up, and maybe thank you again for this really stimulating discussion. I should have mentioned as well that our colleague and the principal investigator actually of this, the Maury's program, Adima Camarosman, has joined us as well for hosting this session today. So thanks, Adima, for hosting and for joining. I'm just going to remind everybody that
Welcome, Joe.
yes, thanks. Just thank everyone who has joined for your participation. And again, remind you that the prior webinars have been posted to the website. I think we dropped the link in the chat if you're interested. There's also a brief exit survey. If you don't mind taking a moment once you leave the Zoom webinar, you'll find a survey pop up on your screen. I would appreciate if you could provide some feedback. We'll use that to help us improve the webinar series going forward. So with that, I just thank you on behalf of the Maurice program and Sharon and everyone involved. So thanks very much.
Thank you so much for inviting me, and thanks for everyone for coming in and looking at your screen.